This is with one of my favorite guys in the profession. And I don't say that lightly. He is a retired periodontist, but the word retired somehow got past him. He is far, far from being retired. He has added so much to the profession. He has a huge online presence. He has a great book. Again, his bio is going to be listed, his website, his book, all of that we're going to put into the show notes. I want to get right to it. And the reason I'm speaking with him today is to demystify periodontal disease, bleeding gums, gum disease. We're going to talk about a lot of other fascinating things. We're going to get a little existential in the end about life and death. But this is a really important topic because, and Al and I we talk a lot, and I've known Al for about, I want to say 4 or 5 years, maybe 4 years. He writes for our website. It's some of our best blog posts. Of course, he has his own website. Perio is a mystery. It's even a mystery to some dentists. And if it's a mystery to us, then our patients certainly are not being well served. So today we're going to talk perio with Dr. Al Danenberg, DDS. So hi, Al, how you doing?
I am great. Thanks for the opportunity. This is just so much fun to be able to talk. Here I am on the East Coast, you're on the West Coast, so we're close to that. And you know, it's like you're in my living room, right?
Yeah, I know.
When I'm looking at out your window, it's like I can open those sliding doors and feel the breeze. It's just amazing. I love it.
Don't jinx it, Al. My internet is not the best. I mean, I'm in California, you're on the East Coast, as you said. And so I'm really excited. Thanks for agreeing to do this video. Let's talk about gum disease, periodontal disease. It is quite prevalent. It is, we talked earlier, there's a study that you mentioned, 90% of college students in one study. In my practice, I would have, if I had been asked, 80%. Some of the lower numbers, older studies, again, it's all about who's diagnosing, what is your criteria for the disease. It's at 60, 70%. But that's still very, very impressive. So for such a epidemic, like a hidden epidemic, essentially, because we all take this for granted. Next time you're brushing your teeth and you see blood in the sink, what should someone be thinking? And what in your mind, and again, you've been doing this for what, 40, 45 years?
44 years, that's a long time.
Right, and you have other qualifications that I want to talk about, so you have a very unique approach and view of gum disease. So what is gum disease? Why the heck does everyone have it? A lot of, as you mentioned, a lot of physicians and healthcare providers have it. Are we in denial? And then this disease, as a lot of my readers and viewers know, this disease causes a host of other things. It's connected to the oral systemic connection. So give me a primer on gum disease. What is it? Where does it come from? And we'll talk about treatment later and all that. But what actually is it?
Okay, this is a question that could take hours, but let's not do hours on it. So gum disease is an infection, and it creates such a vicious cycle in the body that it just goes round and round and no one gets a handle on it, because no one, for the most people, don't really even understand where it comes from, but I'm going to tell you. But I'm not going to tell you yet. So let me just say that, first of all, gum disease is divided into 2 different diseases generally. One is called gingivitis, which is an inflammation with bleeding sometimes in the gum tissues that are surrounding the tooth root. Then there's another disease, and it is a different disease. Everybody that has gingivitis does not go to the next stage, but you can't get to the next stage unless you have gingivitis. So gingivitis is that inflammation in the soft tissue of the gum. And then there's another disease called periodontitis, where this infection kind of changes the complexity of the bacteria, gets under the gum, breaks through barriers between the root and the jawbone, breaks down the bone and leaks into the blood system and creates a host of other diseases and potentially serious problems. But again, that's not where disease started. It's emanating from the mouth, but that's not where it started. There's another starting place. So you have gingivitis and periodontitis. And studies have shown that, as you mentioned, almost 92% of the adult patient population have some inflammation in the gum tissue, which should never happen. And that is a direct result of several things we'll talk about. And then maybe 47% of the adult population has what's called periodontitis. And if you're over 65 years old, that jumps to 70-some% of our US population. That's huge. I mean, that's a huge prevalence. And all of this needs to be treated because it's infection. Now, this infection in the gum tissue is generally thought to be a result of dental plaque, the biofilm around the tooth. So let's get something straight. It's not a disease of dental plaque. As a matter of fact, dental plaque is healthy.
Thank you
until
for
it's
saying
not.
that.
Until it's not healthy.
So important, yeah.
99% of the dentists don't realize that,
Right.
and that's why they put their patients through disclosing solutions, which are dyes to have patients rinse in or swish in their mouth. It makes a beautiful red color on the dental plaque biofilm around the teeth. And then, of course, the hygienist teaches you how to scrub it to the point where it's completely removed and wants you to do it every day. So they want you to use these disclosing tablets at home so that you destroy the healthy biofilm called dental plaque. So let me just mention, dental plaque is made up of maybe up to 700 different types of bacteria, and they're all in a state of balance. So what does that mean? It's like your garden that has a lot of grass and other things growing. If you're feeding it right and protecting it right, it's a beautiful garden with lots and lots of different species of things that are growing. So these bacteria in the mouth are actually all kinds of species. And if you looked at each individual bacterium, you would find some that have the potential to be very virulent and pathogenic and create gum disease and tooth decay if they are overgrowing. But when they are in balance, they are critical for the health of the mouth because they keep other bacteria in balance. And when you remove the most virulent bacteria that you think is going to cause disease, other bacteria that never are a problem become a problem, because they don't have the controls. So your mouth, if it's healthy, is in a state of balance. And that dental plaque is in a state of balance. And that dental plaque serves three critical human functions that it was designed to do. Number one, it is the gatekeeper for nutrients in the saliva to get into the tooth root. And I don't believe that any nutrients that are in a toothpaste are ever going to get into the root surface. Right. But in your saliva, the nutrients that are absorbed from a healthy diet get into your blood system, get into your saliva glands, and are in concentrations that are leaked into your mouth through the saliva. And those minerals that are critical for the tooth literally pass through the healthy dental plaque, and as a gatekeeper puts and presents those minerals to the root surface to remineralize a tooth naturally 24 hours a day, 7 days a week. The other thing that dental plaque does that is a critical factor is that it includes a variety of buffers inside this garden of bacteria that actually protect the acid levels from touching the gum and tooth root surface. It maintains a pH of 5.5 or higher, meaning it's not very acidic, so you can't get a tooth decay if the dental plaque is healthy. Who would have thunk it, right? The dental plaque is preventing tooth decay. Well, right. It is.
It is.
The other important role of dental plaque is that these 700 or so species of bacteria are producing a variety of different forms of hydrogen peroxide. And that hydrogen peroxide in the dental plaque is a killer to other pathogenic bacteria. So other potentially pathogenic bacteria in your mouth that want to get into the gum tooth root surface, if they try to do that, the dental plaque kills them because of the natural hydrogen peroxide.
Right.
So if you strip this dental plaque that is healthy away from the tooth all the time, you are exposing the root surface to acids that never would be exposed, to maybe nutrients that are just flowing from the saliva into your gut, and therefore they don't have time to get into the root because it's not absorbed by the plaque. And then, of course, there's all the acids and the bacteria that are there create decay on the root of the tooth. So the dental plaque is important and it's critical. And we know that if we look at ancestral skull jawbones from 10,000 to 20,000 years ago, we can see lots of calcified material around the tooth root near the bone, which is actually the dental plaque that has calcified the tartar or calculus. And the bone is relatively healthy and the tooth is relatively free of tooth decay. So all that dental plaque was not a unhealthy thing as long as it was in balance.
Back to the garden analogy, Al, which
Yes.
is wonderful. I love metaphors or analogies. So you're trying to grow something in your garden, and your soil has to be the right pH. It has to have the right mineral base in it. That would be like diet, and then you start throwing in like pesticides and herbicides and other things. That would be things that are in oral products like toothpaste, and that would be the surfactants, triclosan, which is actually a pesticide that was in Colgate toothpaste for a long time. So talk about how what we as a profession have been recommending for a long time is actually bad and can cause that need to nuke or take down that biofilm. Why are we recommending that in general? And where should we go from not recommending to that?
Why are we recommending that? That's a great question. We were taught that, and those people that are taught that never open the box lid to look outside of their own box to see what else is in the environment, are myopic, and they are only learning or they're only professing what they've learned in the past, or they're not educating themselves. Dental plaque, for the most part, is unhealthy because we are a basically unhealthy population. Statistically, 60% of our population has one chronic disease. But if you look at primal societies in existence today, there's almost zero chronic disease. So the CDC has estimated that 70% of all deaths are a result of a chronic disease. Where does chronic disease come from? And by the way, periodontal disease and tooth decay are chronic diseases.
Yes.
Well, where are they coming from? Is it from this plaque? Well, sort of, maybe, but not really. And what I mean is that plaque was healthy at one point in time if you were healthy, but why is it unhealthy? And it's unhealthy, like you said, we're putting chemicals in our bodies that shouldn't be there, in toothpaste and a variety of other things, in the food products that we're eating. Certainly dirty electromagnetic fields have an effect on cellular structure. Stress, emotional stress has a huge effect on cellular structure. Over exercising and exercising puts stress on the body in these ways that damages eventually the mouth. Poor sleep habits, including sleep apnea that we don't even understand that we have, are creating problems. Crowding of teeth, it makes it inaccessible for us to do what we need to do to maintain a healthy mouth. Poor dentistry, doing fillings that have margins that are irritating or cracked, root canals that never treat the actual infection inside the bone that is disseminating. No one knows that except maybe 5 or 10 years down the road or longer. There are so many different things. So we need to kind of figure out what the real problem is or where the problem comes from. And it's not really related just to the mouth. It's actually related to damage in the gut and the garden of bacteria that is in the gut. There are 38 trillion gut bacteria, and there's only 30 trillion human cells. We are more bacteria or microbes than human cells. That's an interesting
We're an
statement.
ecosystem. We are not a individual biological entity. We are an ecosystem, essentially.
Correct.
Yeah.
Correct.
What about, so let's talk about, I mean, the gut microbiome is huge, but the oral microbiome or plaque, that plaque layer, that is essential for keeping the mouth healthy and invading viruses and parasites and bacteria, but the oral microbiome, if we knock that down and brush it away and scrub it like we've been told to do, how does that affect the gut microbiome? There's certainly a spillover effect there.
Well,
And
there's something interesting about that. It is said that the gut microbiome the oral microbiome causes damage to the gut microbiome. There was a paper that was just published just a couple weeks ago that I just saw on PubMed. I didn't read the complete article, but I read the abstract. And it's very interesting. It was a study of mice, and they put a very virulent bacteria that causes periodontal disease called P. gingivalis into the mouth of these mice so that the mice would swallow it, and then they would determine how it started to grow in the gut. The problem with this and many studies in rats and mice is that the stomach acid in mice is like 3.7. The stomach acid in humans is 1.3. Right. P. gingivalis doesn't live in a stomach acid of 1.3, but it does live in a stomach acid of 3.7 to get into the gut. Mm-hmm. So these studies that say the mouth bacteria transfers from the stomach into the intestine and causes dysbiosis, I have a problem with. Right. Here is what really I believe is happening. First of all, the gut becomes dysbiotic. It gets out of balance. Pathogenic bacteria overgrow. Why is that? Well, poor diet and an inflammatory diet we can get into creates some of that problem. Stress creates some of that problem. The other things that I mentioned, electromagnetic fields, poor sleep, too much exercise, not enough exercise, damages the gut microbiome. All the chemicals that we're breathing and eating in our food damages the microbiome. And when the gut microbiome changes and it becomes unhealthy, several cascading events occur. Number one, this huge population of bacteria, again, 38 trillion cells, talk to the immune system and stimulate the immune system to function. And the immune system starts to produce a variety of chemicals to try to change the unhealthy bacteria and kill them or become more in a state of balance. So now the immune system is triggered and it constantly is overworking itself. And it's always being triggered if the gut dysbiosis doesn't go away, and it creates holes in the gut lining, this little one cell layer thick lining of the gut that literally separates this hole that goes from our mouth to our anus that is not part of our inside part of our body yet from our circulatory system.
That's a very interesting point, Al, because a lot of dentists are talking about the effect of the oral microbiome on the gut microbiome. But if the gut microbiome on its own is dysbiotic, as you said, the inflammation, the immune system basically is told to react. It's an overreaction. And gum disease essentially is an overreaction to an infection. And that's when it gets out of control. It's liquid of bone and necrosis of tissue. And it just, so you're right. I mean, it's all connected in so many different ways.
But the interesting connection, as I see it from the research I do, is that this bacteria that is out of control in the gut and the immune system becomes somewhat dysfunctional, and the gut lining is breaking down, pours some very infectious stuff into the bloodstream, creates a condition called metabolic endotoxemia, but it's an infection in the bloodstream, and it penetrates and circulates everywhere, including the mouth. And some of these chemicals called LPS, lipopolysaccharides, that are part of the junk that gets out of the gut lumen into the bloodstream, affect the mouth as well as other organ systems. And it changes the friendly garden of bacteria in the mouth to an unfriendly garden. And now the bad food we're eating that actually aggravates the gut dysbiosis and makes it even worse is feeding some of the bad bacteria that are overgrowing in the mouth. So this is where you get this vicious cycle. Right. And all of the bacteria in the body communicate with one another with chemicals that they produce, with frequent frequencies they produce, and it all transmits through this mucous membrane that is throughout our entire body. So now all the bacteria are talking among themselves, saying, oh, this is happening here in my toe, and that's happening in my gut, and this is happening in my lungs, and oh, by the way, this is happening in my mouth.
Right.
And it talks to one another, and it really overreacts, like I said, the immune system. So yes, you need to be aware of these problems in the mouth, but you have to be aware of the problems in the gut. So the gut is pouring into the bloodstream, called a leaky gut, and now the infection in the mouth starts to get under the gum, and it leaks into the bloodstream. You have a leaky periodontal pocket. So you have bacterial infection going into the bloodstream from the gut, and you have infection from this periodontal disease that started with the gut, but now is prevalent in the mouth, gets into the bloodstream, and now the vicious cycle with all this cytokine, all the chemicals that are emitted by a dysfunctional immune system start to overwork all the other organ systems and start to break down into chronic diseases.
It's not a chicken or egg thing. It's essentially, for example, you can have gum disease, which will affect or promote the ability for you to get diabetes, but vice versa. If you have diabetes, then it's hard to regulate your blood sugar levels, and that can actually promote or give you a predilection to getting gum disease. So it's this circle that just keeps spinning, and there's so many different ways that you can connect to these different diseases and how they interact with each other.
Yes. Yes, I do believe the central point, like the hub of a heel, everything is starting in the gut. Hippocrates over 4,000 years ago did say that all disease begins in the gut. Now, I'm not going to say 100%, but I think it's high 90%.
Definitely a big factor, yes.
It's a huge factor. And I do believe, and there are studies that show that if you change the gut bacteria, you change the mouth health. And if you change your diet, if you change your diet to improve the gut dysbiosis without doing anything in the mouth, as long as it's just inflammation, the inflammation will go away without brushing your teeth. Some of the studies have shown over a 4-week period with no brushing or flossing, lots of dental plaque, but all the bacteria are in a state of balance when the gut gets healthy. It transfers.
Let's talk about, well, brushing and flossing have always been oversold, especially by dentists. But let's talk about treatment now. So let's say you have a patient who has type 3 perio. There's some bone loss that is evident already. I mean, it's pretty advanced at this point. And they'll never get that bone back. The gum recession is hard to reverse. We're arresting the disease at that point. What advice would you give that person in the context of the gut microbiome, diet, dry mouth, pH changes in the mouth? I mean, other systemic diseases like Crohn's or hypothyroidism. I mean, it's very complicated and multifactorial.
It is complicated. So basically what I do, when I was active at practice and when I do now when I'm doing consultations, I have individuals, number one, fill out a very detailed questionnaire to give me some real information about their medical and dental histories. That's very important.
Right.
I need to know what's in their mouth. Are there silver fillings, mercury fillings? Are there just composite fillings? Are there root canals? Are there crowns that don't fit well? I need to know these things.
Base metal.
Yeah, the metal. Right. Yeah, we need to know all these things. I have them fill out a 3-day food journal in detail. That lets me know everything they eat during the course of the day. Breakfast, lunch, dinner, in between meals. As a matter of fact, we'll talk about this course that I wrote for the AADSM, but I think that part of your medical dental history should be a 3-day food journal for every patient. And then you can use that in the future to see if they've improved that, or if they have a problem, you can relate it to some of these unhealthy inflammatory foods they're eating and educate that patient. But anyhow, so I get that information, and then when I get that information, I go into a conversation. One of the conversations is, I need you, the patient, to understand how you need to clean your mouth appropriately.
Right.
Now, if we have infection that is active and acute, meaning very severe and with lots of bleeding and systemic complications, then I'm going to consider several things. One of the things that I would consider is obviously changing your diet, but one of the things I would consider is a debridement of sorts, whatever way we can clean out the mouth to remove the irritants. So if you had a splinter in your finger, no matter what you do for your overall body, no matter how healthy you are, nothing will remove and heal the splinter unless you physically remove the splinter. So if you have a source of this infection, maybe it didn't cause it, but right now it is a source of irritation to the body,
Right.
which would be called calculus or tartar, that is under the gum. It's a bacterial component. It's irritating. It
Toxin.
needs to be removed.
Right.
So scaling and root planing is a procedure that has been done for decades. It's very efficient. It literally is like removing a splinter from your finger. It's removing this foreign object that has gotten out of control, associated with active inflammation and infection. We need to remove that. So we do that. And generally, a scaling and root planing is done with a local anesthetic, because it would be uncomfortable if it's done properly. It would be uncomfortable for the patient. So it has to be numb in one way or another. And the procedure generates bleeding, because this is infection to start with. You've already probably are seeing bleeding. But as the disease progresses, the bleeding kind of goes away because the disease gets deeper under the gum pocket, so it's not so obvious. But we do this scaling and root planing. Meanwhile, there may be certain medicaments, medications, mouthwashes that I might recommend to get more control of this out of control bacteria. I never recommend antimicrobial mouthwashes on a regular basis, but when we're dealing with infection, we may want to use a hydrogen peroxide mouthwash, or maybe even another type of antimicrobial mouthwash, all along understanding that I'm killing a lot of good bacteria along with bad bacteria. So I am also going to suggest that these patients use certain types of probiotics, spore-based probiotics to be specific, that gets into their gut to help reestablish a new microbiome, which is going to take months. It's not going to happen really quickly. You use a systemic antibiotic, you kill bacteria in 5 days, but it takes months to regrow these bacteria properly. So it takes time, but I want to get that process under control. So I've shown the patient, or my hygienist has shown the patient, how to clean their mouth properly, brush, floss, and these interdental cleaning picks, which are extremely beneficial. And then we do this deep type of cleaning to remove the irritating splinters. We're going to get a result, and the result is going to be good. Now, are we going to have control yet? No, not necessarily. So if there's damage in the bone, which is periodontitis, once we get the tissues under control, we can see how the tissues are responding. But if there are deep damages in the bone, we need to treat the bone in a more regenerative way. Used to be that we would cut the gums open and do surgery in the bone and do bone grafting and all kinds of procedures and close the gum tissue, and we get kind of maybe a good result, maybe not. The patient would be very uncomfortable. Life would not be great for several weeks. Today, there are some laser procedures that actually have wonderful research that is very patient-friendly, where we do not have to cut the gums open. We just numb the gum a little bit and place these little laser tips that looks almost like a little periodontal probe under the gum, and it shoots out some light at a pulsating rate and a certain frequency, and it cleans the area as well as somewhat sterilizes, because it kills the very pathogenic bacteria. And more importantly, it penetrates the bone and stimulates stem cells inside the bone that regenerates new bone and new mitochondria, which is fascinating.
Right.
So we can actually regrow bone that has never been predictably regrown, and the patient goes back to work the next day and with no swelling and no pain.
Definitely much less traumatic than the classic
Right,
osseous surgery.
and with new and better healing results. So that's how we treat, and that's how I treat periodontal disease. And generally, I don't want to use systemic antibiotics if I don't have to, and I use some herbal products.
So Al, what you're saying in a nutshell, and that was very well said, and I'd like to hear later what kind of lasers you recommend, which type, but what you're saying is that if your periodontist or dentist is just recommending scale and root planing, the deep cleanings where you get numb and come in more than once, and and maybe some good biofilm management instruction, that's oral hygiene instruction, and then they sit back and wait to see if there are results. What you're saying is that they're not really practicing to the standard of care because they're missing out on the immune system part of this equation, and that is the gut microbiome, diet, and proper management of the oral microbiome. Is that
Absolutely, absolutely, and that's why a lot of patients go through the procedures, and 6 months later they come back and they still have bleeding gums, and the doctor says, "I don't understand why the gums are still bleeding. I don't see this or that. I've done a deep skin." Well, we'll do it again, and we'll do it again. Or we're going to kill it with this more virulent, more aggressive antimicrobial mouthwash, or these trays that have antibiotics in them that you stick in your mouth for overnight. And you do all these things to kill the microbiome, which of course you're killing all the good stuff, and you never, ever address the source of the problem, which is the gut and the diet. And supporting the immune system.
Yeah, so to prevent gum disease or periodontal disease, you really have to manage your immune system and your diet and your environment.
Yes. Yeah. Yes. So if I were to talk to a person that like one-on-one, but let's say through a Skype or a Zoom conference, and that person says, "Well, I really want to get my kids healthy. What do I need to do to make sure my kids don't have this gum disease that I have?" I will tell them, number one, we need to figure out what they're eating so that we remove the inflammatory foods, the grains, the sugars, the processed seed oils, possibly the legumes, certainly anti-nutrients like oxalates and lectins that are in certain plant foods. We need to do that without a doubt. And if you do that, that will help prevent problems in the gut and chronic disease going forward. And by the way, teach them how to clean their mouth properly. We're not going to sterilize the mouth. We don't want to scrub away the dental plaque through the pellicle, that there's nothing protecting the tooth. But if you brush your teeth gently with a soft tissue bristle brush, and you use these soft bristle silicone brushes between the teeth to clean out the excess plaque, the pellicle will remain. You're not scrubbing that off, and the healthy bacteria can do its job.
Right.
So we're not sterilizing.
Even if you could remove 100% of your biofilm or plaque in one area, it comes back in 10, 15 minutes. The body is
absolutely. So the concept is, a lot of dental offices do this, as you know. They will say, to make sure this film doesn't ever regrow, we're going to put you on xylitol constantly. Chew xylitol gum and use these chemicals that destroy the attachment of the pellicle, which is that sublayer that touches and attaches to the root surface. So you theoretically can remove dental plaque 24 hours a day, 7 days a week, if you really do all these chemical additives, which is so unhealthy. So unhealthy and not natural, because this is a healthy biofilm. It's there for a purpose.
We're using a lot of products in our oral health care products, mouthwash, toothpaste, that essentially is the equivalent of using an antibiotic every day of your life, if you're using those products every day. It's almost
right. That's
well,
right.
I 35 years ago in dental school, I had a head of the department of periodontology, Dr. Walter Hall, an amazing man, great teacher. He essentially back then said to us as students, but also in his textbook, I think he wrote the book on local mucogingival problems. But anyway, he was a fascinating man, and he said to us something that at that point we had already been indoctrinated about the biofilm and doing a prophylaxis with a rubber cup. And he said there's really no efficacy or benefit to removing that after your scraping and ultrasonic cleaning. And I always thought that was fascinating. And it turns out he was right. So would you, if you were in practice still, would you recommend that your hygienist spend that 5, 6, 7 minutes of rubber cupping the teeth with fluoride and pumice? And is that necessary? I don't think it is.
I think it's more damaging than necessary. I think appointments are necessary because you can't see what's going on in your mouth. So I think you need to see your dentist. And if the dentist is more biologically oriented, and that's a strange term because it's not a legal specialty of dentistry, so anybody and everybody that has a dental license can call themselves a biological dentist, which is very misinforming the general public, because You know, some people know and some people don't know what they don't know. But your dentist should be able to look at your mouth, do a visual exam, and see if there are signs and symptoms of disease.
Mm-hmm.
Dental x-rays are necessary because, you know, if you have a car that's making a terrible sound and you go to the mechanic and he says, well, pop your hood so I can see what's going on. And you'll say, no, don't pop my hood. Just tell me what's wrong.
Right,
Well,
right,
you just can't do that. When you look in the mouth, you see certain things,
right,
but to pop the hood, you need to see into the bone. And if you want to look in the bone, today, the only way to do that is an x-ray machine. So you
right,
have to have some dental x-rays. Of course, you don't want to do dental x-rays every day because low dose ionizing radiation, which are dental x-rays, are potentially harmful to DNA and cell tissue. But no dentist is going to do that on a regular basis.
right,
But you have to have some x-rays to look at what's going on whatever frequency is necessary based on your risk, on how much disease you present with. So the dentist can look and see what's necessary. And if he or she sees basically no bleeding gums, firm tissue, maybe some recession because of other issues in the past, but basically no active disease, do you need to have your teeth clean? No, I don't think so.
right.
Do you need to have even more so a rubber cup and pumice and all these things? I don't think so. So, I mean, I don't believe that it's necessary, but I think the exam is important. But if there is active unhealthy dental plaque and any signs of bleeding, yeah, you need that because you need more instruction, not just in your mouth. You need instruction of what you need to change in your diet and lifestyle. That's the fault of the far majority of dentists, even biological dentists, because they do not
Right.
get involved
Very
with
vertical.
nutrition.
Yeah.
Yeah. Yeah. They may
So,
talk about killing bacteria, but they're not talking about
yeah.
treating the gut.
So let's talk about that. That's a great segue into another question I had for you. It's one I ask often. You know, I always say that we're handicapped by our education in some ways. And what we just talked about is a very comprehensive way at looking at an autoimmune, very destructive cytokine type of release disease that is connected in so many parts in so many aspects to the rest of the body, systemic diseases and inflammation. What does dentistry need to do to fix this? I know that you have a course that you're teaching. Let's talk about that. But what in general, what would a lot of dentists are listening to this video, and they always ask me on our website. It's like, where do I get this information? We can talk about your primal certification. Where do you get this functional approach after you've gone through dental school? You've kind of been brainwashed, and again, there's very little time in the dental curriculum. I get that. You know very little bit about sleep and facial development and even occlusion. A lot of dentists come out with very poor understanding of occlusion and perio. So what can be done to improve the dental education? Maybe it doesn't come there. Maybe it comes afterwards. And what would you tell a dentist that has just graduated to think and treat and look at the big picture to be a better dentist?
Well, I'm going to plug this course first because it tells the story. And so the International Academy of Biological Dentistry and Medicine came to me, and I certainly have worked with them and have written some articles for their website in the past. And they wanted a periodontist as a chair on their board, so they offered that to me, and I graciously accepted it. And they wanted me to kind of put together some kind of a program. And I'm thinking, you know, what you're saying is just not known by any dentist generally. I have failed to find more than a handful of dentists that kind of know the things that I'm talking about.
Right.
So I created a program that is going to be a certification program, the first ever in the world, actually, and it's going to be called a Certified Biological Nutritional Dental Professional. And it is going to be offered to all dentists, all hygienists, and dental staff if they want. And they can apply for that through the IABDM, the International Academy of Biological Dentistry and Medicine. It's
We'll have
.org.
that in the show notes, so don't.
Yeah, okay. And so that organization now has this program available. It is a 1.5-hour series of video webinars with a host of all kinds of published material that I created. And all that material is there, the reading material for the course, and that will give people the information from peer-reviewed literature. This is not just my idea. These are studies that have been published in recent current medical journals throughout the world, and supports the concepts that I'm talking about in this course. And it teaches individual dentists how to institute a nutritional program in the dental office, because there is a dental code for nutritional counseling. Most people don't know that. Right. And dentists are legally responsible to do nutritional counseling for dental problems. But guess what? Yes. If you do nutritional counseling for dental problems, you are improving the overall health and well-being of the individual. Right. Because it's all starting in the gut. Yep. So what this course is a program that you can institute in your office. It talks about marketing concepts, where the gut problems are, how to treat the gut, how to treat the mouth. It is a kind of an accumulation of this nutritional and biological concept, which really needs to get out there, because every dentist has a platform like no other healthcare professional, because dentists look in the mouth of every patient on a couple times a year. They are the perfect person to look at disease, inflammation, because the mouth is a mirror of most chronic diseases, and they can either relate to treatment and understand and change the lifestyle and diet of that patient, or refer that patient to other medical professionals to treat and diagnose other chronic diseases that are now manifesting in the mouth. So there's a host of things that can be done.
So in other words, a young dentist who we call a safe beginner. I remember being called the safe beginner when we came out clinically.
That's a great phrase.
Oh, it is. They also, again, the curriculum is packed, and there's a lot to learn as a dentist. And as you said, we are in what I call a pole position for recognizing so many things. We spend more time with our patients than most primary care physicians do with their patients, and we can see a lot. We can recognize sleep apnea, for example, decades before a physician can. But so this youngish, safe beginner, not only are they just new and very green, they just don't have a lot of experience under their belt, they also don't know everything there is to know about diagnosis and this broad realm of what we're able to see and recognize and diagnose. And that's why I think the answer is you really have to get this after your primary dental exam.
Yeah.
And your course sounds fantastic. I mean,
it's a very complete type of course with all the extra reading material actually supports much more than the course actually goes into. Right. But I'm 73 years old and I still don't know a lot of things. So no one is going to get to know everything. Right. And the other thing that's interesting is what I thought I knew 2 months ago, I'm now learning that's not so true, but something else may be true. So we are always, hopefully, we are always open to new knowledge, and we really need to do that. And we have to be aware that we need to make paradigm shifts as time progresses, as knowledge progresses. And even if you've been doing the same thing all the time, getting the result you got, but all of a sudden you realize something in that protocol you're using is not so healthy and may manifest to a different type of problem 10 or 20 years later, you need to make the change and not just keep doing what you've been doing. I know that local dental schools in my area are still teaching putting mercury fillings into teeth.
Yep. I know.
I don't even know how to begin that conversation with the restorative departments in dental school, because these are intelligent people. How can you talk to an intelligent person that thinks these are a perfectly healthy procedure?
I don't want to go down that rabbit hole, but in short, I think they think that the amount of mercury that does get into your system, which is a neurotoxin, and it's It's very difficult to get rid of once you have it. The body tries to wall it off. But I think they think that since there are other sources of mercury in our environment, it's a very laissez-faire way of looking at it. And there's no way as a patient you want to be seeing someone who has that attitude, because it's going to carry over in other areas where, don't worry about that toxin. We can't do anything about it. And that's not the approach that anyone, even just if you're worried about your own personal health, of course, it's not hopeless, and we can't fix everything, but we should be aware of everything. And we should be doing as much as we possibly can to prevent these toxins from getting into us. So that's just.
I agree. I mean, the body is amazing. Our natural production of glutathione really can detoxify mercury.
Exactly.
But the problem is, how much load are you getting of mercury and fluoride and arsenic and other chemicals in your environment, and overloading your natural body's ability to remove these? That's where the problem is. So like you just said, it's more important to fight the battle that you can win. Just prevent what you can prevent. Avoid what you can avoid. And if you can't get every piece of mercury out of your body, okay, I don't think that's the worst thing, but don't keep loading your body with overly stressful, toxic material that your body cannot respond to.
Do you think it's ironic or worse that dentists are putting in metal fillings with mercury and then later are concerned about periodontal disease in the same patient? Do you think there's a connection with the immune system?
Of course there is. Absolutely. Absolutely. But they don't know the connection.
No.
They don't even realize that there's a connection.
That's what it is.
Or even dissimilar metals that are creating an ionic transfer. They don't understand that.
Right. Yeah, exactly. Yeah. It's interesting. So let's talk about, I just want to touch on your Primal certification. A lot of people don't know what that is. That is a very interesting aspect of any healthcare provider. And what is your take on that functional approach and the Primal knowledge of essentially what our ancestors did and didn't do and what they ate? Why is that so important? Why should every dentist just get that certification, or at least become more aware of that way of thinking?
Mark Sisson created the certification for Primal Health Coaching way back. I'm not sure, maybe 6 years ago. I can't remember, but I was one of his first students. And it was really an eye-opener for me, although I got some education about primal nutrition. His program really set things straight for me. And why is it important? Because our primal ancestors naturally ate a diet that was anti-inflammatory and didn't have chemical irritants in the environment. So what they ate and the way they lived, although they died young because of a variety of reasons, they were killed by warring factions, they were killed by animals, they fell off cliffs, they had infection that they couldn't treat, but whatever the reason was.
But it wasn't chronic disease.
But it wasn't chronic disease, and we know that. And the chronic diseases are a part of bad diet and bad lifestyle. So correcting the diet and the lifestyle is the critical element.
Right, I agree. I think it's
and that's why primal, and that's why the primal coaching is effective, because it teaches basically a paleo diet, removing irritants like flour products and grains, removing added sugars, removing the processed seed oils, supporting an organic way of eating, and creating a lifestyle that is also healthy, which is efficient exercise, restorative sleep, reduction of emotional stresses. All of that combines to a healthy body, which means a healthy gut microbiome.
A lot of my patients are, CEO types. They don't have a lot of time, and I will give them as much advice, nutritional advice and health advice as I can, but I only have them for maybe an hour at best. And these types think in a certain way, and they're looking for that condensed, kind of abridged version of what do I need to know to stay healthy and do my job. And that's a great question. I respect that. So a lot of the advice I give when I hear that is, if there's one page that you want to look at for overall health, I send them to Mark Sisson, the what's it called, Mark's Daily Apple. I think that's a great place to start for overall health. And I think the world of Mark Sisson. He's amazing. His Primal Kitchen products,
Are amazing.
fantastic foods. Yes,
Yeah.
but that's a great place to start. Of course, he walks the talk. He's in great shape for his age. And when I became fat adapted, I think that was a real. I mean, I've been a health nut all my life. Back in 14, 15 years old, I wasn't reading comic books or Mad magazines, although I was, but I was reading life extension books, and I was
Oh my God.
in biochemistry, and that's what was my undergraduate degree. So that I've been a health nerd all along, and of course got a lot of stuff wrong, like saturated fats and veganism and all that. But I have to say that being fat adapted, and I was introduced to that concept by that website, is life-changing. So just that's why I brought up the Primal certification. I think it's a great place
I
if you're a layperson,
totally agree with you.
for a
And
dentist, for yourself, or for your patients. Learn everything there is to learn on that site.
I told Mark, and Mark is kind of a buddy of mine, and I told him he needs to market his program to every dentist and
Yeah,
medical
right.
doctor out there.
Yeah,
You don't have to be a health coach to get that certification and understand what is involved with getting the body healthy.
yeah.
So I totally recommend that, and I totally agree with
But
that. Yeah,
Dennis,
but you mentioned the term fat adapted, and I think a lot of people don't understand that.
mhm,
Basically, we are carbohydrate freaks. We
mhm,
live on excess carbohydrates, and our body uses that for energy. And when it is done with what it uses, it stores it as fat because it doesn't know what else to do with it. And our primal ancestors didn't use that carbohydrate for energy on a regular basis because they didn't have excess carbs to eat. They used fat, and that fat is in our body. We have much, much more stored fat for
right.
energy than ever we had stored carbohydrates. And being fat adapted just means you have trained your body to go back to the way it was designed to be. And that
Exactly.
means that you're not eating excess carbs. Your body is looking at fat and breaking down fat. Your liver is transferring some of that into ketone bodies that then it uses as it would glucose, but even more efficiently and cleaner. And that is what makes people stay
Right.
healthy and
Right.
leaner
Yeah.
rather
Oh,
than put on
I'm
a lot of excess fat.
I'm clearly a better person when my brain is burning ketones, and I monitor that. And I used to be a big carb loader
Oh
athlete,
yeah.
and it worked, but it didn't work as well as what I'm doing now. And they were high quality carbs, but that's not the point. It's really a return to what our ancestors did. So that was a nice explanation. You talk about this in your book. I think it's called Crazy Good Living.
Yes.
I looked it up the other day. I read it a while ago. I probably will read it again because it's helpful information. It gets great reviews on Amazon. What made you write a book? I mean, I'm a dentist who wrote a book. I know only of a few. What made you write a book? Where did that come from?
Well, probably the same thing that made you write a book. And that is you have this information that you're aware that makes sense. You've worked with patients for many years getting results because of what you're what you are doing right now.
Mhm.
And you just want to try to get it out there. So writing a book does a couple things. For me, it made me research things that I didn't know. So I got more educated as I wrote my book
Mhm.
because my book has lots of cited peer-reviewed literature. So I'm learning as I'm writing the book, kind of formulating this constant changing protocols in my brain of what's the right thing to do and putting it in hopefully a way that's more anecdotal, like I'm speaking to a person rather than somebody's reading a medical textbook, so that it's understandable, but it is relevant to overall health and more specifically, of course, to oral health, which is my profession. I'm not going to write a book on how to treat Alzheimer's, but I can certainly tell you that if you can support your immune system and get your mouth healthier, by the way, the Alzheimer's may get better or never actually occur. Rheumatoid arthritis may never occur. A variety of other chronic diseases may never occur if you get your gut healthy and reduce stresses in your life and get good exercise and good sleep. All of those things are really important.
Yeah, you brought up an interesting
And that's
point.
what really the reason I wrote it. just
Right.
to get it out.
And that's the reason I wrote my book, essentially. It was frustration out of what I was seeing, treating myself for something, sleep apnea. But you touched on that a little bit. Alzheimer's, a lot of patients that are worried about Alzheimer's, they'll have a conversation with me. They'll tell me they have the gene or their parents died of it. And the first piece of advice I would give them is to make sure that you never have inflammation in your mouth. That would have a greater effect on preventing Alzheimer's than probably anything else, except maybe diet and exercise. But diet, exercise, and making sure that you never have inflammation, i.e., periodontal disease or even gingivitis in your mouth. Would you agree with that?
Absolutely.
I mean,
Absolutely,
yeah,
because the inflammation is going to spread through the circulatory system.
yeah,
Even if you ignore the fact that the inflammation probably originated from the gut because of changes,
right.
changing the inflammation in your mouth is certainly a critical component. And if
Yep.
you never understand the gut, but you really get control of inflammation in your mouth, you're going to have a better result. Not a complete result
Right.
because you still have that flame brewing in the gut, but at least get that fire out in your mouth. Start reducing the fire in your gut when you
I
get
mean,
a
we
chance.
now know there are 2 studies, maybe 3 at this point, recent studies that have identified a substance that is as a result of that cytokine kind of overreaction of the immune system in the mouth, that inflammation that we're talking about, the fire, and then that it's called the Gink Japan, that gets into the bloodstream, which is how gum disease typically affects other organs. It's that infection. There's a metastatic mechanism as well, but an injury mechanism. But that Gink Japan gets into the brain, past the blood-brain barrier, and is now known to be a cause of gum disease. I mean, that connection between Alzheimer's.
Mhm.
That connection between gum disease and Alzheimer's is known. It is something that we can prevent. My mother died of Alzheimer's. She had some perio, and metabolic syndrome. This is something we can prevent. This is an important function that I think dentists can pass on to their patients. You can prevent gum disease, Alzheimer's and gum disease, Alzheimer's. So, when the patients come in and say, I'm going to get it, eventually my parents have it, I tell them, no, absolutely not. And I love to get the
And,
history of their parents, their oral history, because there's always that connection. They'll go, yeah, as a matter of fact, my mom had a few missing teeth and was wearing a partial denture, and and
sure.
obviously it was gum disease that was a comorbidity or came along with that Alzheimer's diagnosis later in life. And Alzheimer's, as we know, starts in our 20s or 30s.
True. Like most chronic diseases, it
Mm-hmm.
starts decades before
Right.
it manifests.
Yeah.
And all of these chronic diseases are multifactorial, meaning that there may be individual things that we see that is a factor, but there are other factors too. But you are absolutely correct. Gingival inflammation needs to be brought under control,
Right.
and it is getting into the blood system. And since the statistics are sad enough to be close to 93% of the adult population has some gingival inflammation, we are very susceptible to Alzheimer's and all these chronic diseases. And
Mm-hmm.
again, I know that I'm re-emphasizing the same, but again, the gut seems to be the central control center of presenting this disease in a continuum fashion into the rest of the body.
Mm-hmm.
And periodontal disease and tooth decay are chronic diseases that really originate in the gut, but once they get started, this vicious cycle goes back and forth, and the inflammation and infection in the mouth creates its unique cytokines and chemical factors that can get into the bloodstream that affect everything else, just like the
Mm-hmm.
gut dysbiosis gets into the bloodstream
Yep.
from the gut.
Yeah, it's fascinating stuff. I would like to talk about one more thing. We're
Yes.
probably about 5-10 minutes away from wrapping it up. This is a personal thing, I know, but you've talked about it freely. And I really think that, I think of you as not only a well-rounded guy overall and especially in what you do in dentistry, and that's why we're talking, because I really respect what you've done. But there's another aspect to you that I think is very interesting, and that is that you have had a chance to face death. You've
Yes.
talked about it openly. I think it's a great segue into learning that if you know, we all know we're going to die, but most of us are in denial, and we've never had that point in time where usually we just die suddenly, and we haven't really had time to prepare and think about it and really appreciate what is so great about life. You have, and certainly give us a kind of a background story on that. But my question is how does that affect lifestyle choices when you know that we all know that we're going to die, but that doesn't necessarily mean we're going to eat well, right? Because there's some disconnect there. But when you get a diagnosis where you're told that you're going to die in, I think it was 3 to 6 months for you due to your bone cancer, how does that affect your lifestyle choices, healthcare choices, and choices you make in your own life in terms of, whether you do this or that? And why is that an important thing to talk about? I mean, do we need to all have that kind of moment where we face our mortality so that we can live better lives? Is that really necessary in the human condition?
I think everybody's a little different, but certainly that's true for me. Um, when I was diagnosed with a incurable bone marrow cancer,
Mm-hmm.
the big name is IgA kappa light chain multiple myeloma. In September 2018, I was given a prognosis of 3 to 6 months to live unless I started chemotherapy right away. And even though I could start chemotherapy, I would still die from multiple myeloma since it's an incurable disease, and the quality of my life would be going down slightly from that point on. And I elected completely to reject chemotherapy because quality of my life was more important than longevity. And I was never in denial, but I knew that I had 3 to 6 months to live because I didn't do chemotherapy, but I was going to do unconventional cancer protocols that would maintain a healthy immune system as best as I could. So what went through my mind was that all of a sudden, um, the practical things in life, the monetary things in life, the material things in life really didn't mean very much. I mean, it costs money to prepare to die, but that's not what I meant. I mean, accumulating all these fancy things in your life. If your income is $1 million, most people that have $1 million income still can't afford this, that, or the other because they're overspending. So basically, all these material things really don't mean anything.
Mm-hmm.
What I delved into in my own head was a lot to do with my wife because she is extremely supportive of me. And I put together, with her help actually, a, a, um, a bucket list of the things I really wanted to accomplish before I died, thinking I was going to die in a few months. And what that meant to me is time, quality time with my wife and my 2 adult children and my 3 grandchildren, so that I could say to them the things that I want to say to them. I had already put together like a time chest when they were all born, my grandkids, so that every year we put things in. And so there was this continuous time chest, but I wanted to make sure that they knew who I was and how much I loved them. And we talked about death, which is important because a lot of people ignore, they're so scared about death, they don't want to talk about it. And they don't have this open conversation because that is actually very satisfying to me. When I knew that I was going to die, it was actually a relief because I knew I had this time and I had enough time to do what I needed to do to get right. So when I started my unconventional cancer protocols in September 2018, I was doing extremely well and actually survived this prognosis of 3 to 6 months.
Mm-hmm.
And it went on very, very nicely until August, September 2019, when I was actually standing in my bathroom, brushing and flossing my teeth. And I knew that I had numerous lytic lesions throughout my bone structure, almost looking like a person that had severe osteoporosis. So I know I've had many pathological fractures up to that point, and that's how I was diagnosed, because I had pain in my chest because I had some rib fractures that I didn't even realize from the disease. So in the latter part of August of 2019, I'm brushing and flossing my teeth, and my feet are planted on the floor, and I twist to the left just a little bit to throw my dental floss away. I knew I had fragile bones, but I didn't know what that really meant. So when I twisted 90 degrees to my left, my right femur literally snapped in half, like a chicken bone.
Yep.
I completely crashed to the floor, of course, broke a couple more ribs, and broke my right humerus in half. I am writhing on the bathroom floor. Whatever pain you can think of that's terrible, just multiply it by 10. And my wife, I'm screaming, and I can't move, and my wife is coming in to the bathroom realizing what's going on. And that's an emotional time, and obviously she calls EMS, and they get there, and they get me on a gurney and get me into the hospital, and I'm ready to die, and I want to die. I knew that I had outlived my prognosis. It's time for me to go because I could never have the quality of life from this point on. So they fixed my right leg because I could have perforated my femoral artery and bled to death. They didn't fix my right humerus, and I didn't accept anything else, and they just sent me to a hospice hospital to die.
Yep.
And now it's the first week in September, and there's a hurricane coming through Charleston, South Carolina. It's only moving at 1 mile an hour, but it has 187-mile winds. So the hospital was ordered to evacuate, and they didn't have a place to send me. So my wife is an RN. She scrambles to get a hospital bed and then brings me to, obviously, the home. In my home, I'm still in hospice. I have a catheter. I'm living with a bedpan. It's amazingly demoralizing, and I really wanted to die. And I was heavily drugged with narcotics, which is another problem in and of itself. So my wife is such a strong woman, and she gave me a little bit of tough love, and she said, you know, you're not a victim, you're a survivor. You did so well on the protocols until this accident, and now you've given up. And she said, you need to get your head together and get it back on track. So we got started with my protocol. She got a physical therapist into the house and helped me, and eventually the catheter was gone, and I could walk with a walker, and I started to get around, and I started to rally. I revoked hospice. I went to my oncologist the following month in October. He identified a couple new immunotherapy treatments. Immunotherapy is not chemotherapy. This is actually human-derived monoclonal antibodies that actually attacks just the cancer cell. Right. So I started to incorporate that with my protocols, and I was doing well. So I continued to do well. In January, I transferred to a carnivore diet for my protocols to support my healthy mitochondria, as well as my gut and my immune system. My other protocols were in place. And then my oncologist in May of this year, May 8th, 2020, says, you know, let's check and see how your cancer cells are doing. And previous PET scans showed lots of cancer. This is a new PET scan. I take the PET scan on a Friday, May 8th, and he calls me that evening and he says, make sure your wife is on speakerphone. And he reads the pathology report or the radiology report, and it says, no active cancer cells throughout your entire body.
And this is 3 years later after your diagnosis, right?
21 months. 21 months.
Wow.
And so I'm asking George, that my oncologist, I said, wait a minute, read this again. I want to make sure I understand exactly what you're saying.
Yeah.
There are no active cancer. Well, yeah, I got it too.
Yeah.
No active cancer cells throughout my entire body from head to toe. Now, I'm not in remission, but there are no cancer cells that can be identified with a PET scan.
Right.
And then there are some malignant proteins that are still floating in my body. I think it's remnants, and my immune system, which I believe is very strong the way I've supported it, has now the opportunity to gobble them up and get them out of my system. But it's an amazing situation because I feel fantastic, yet I was literally ready to die narcotically
That
driven.
that just gives me goosebumps hearing that story. And we live our lives in hindsight. Typically, we look back. We don't look forward. We don't plan for what could happen. What advice would you give someone? You made a lot of lifestyle changes. I think the carnivore diet is an excellent cancer diet. It could be an excellent diet overall. I'm a paleo guy. I do eat some vegetables. But I've locked out sugar completely. Sugar is just, that's a whole nother hour of discussion. But what advice would you give? You've been on the other side, Al. What for people that are thinking, oh, I'll be fine. I can have that cupcake because, I'm healthy or I'm thin and I'm doing fine. But what advice would you give to someone that isn't thinking that way?
People that have chronic disease, that
Mm-hmm.
develop chronic disease,
Mm-hmm.
started their chronic disease process
Mm-hmm.
30 or 40 years prior to
Right.
that.
Right.
So it's very difficult if you're on train tracks and the train is miles and miles away to think about, well, I'm going to get off the tracks before it runs me over.
Mm-hmm.
Most people need to wait until the sound is so close that the vibration is there, they have to jump off the track. You have to be proactive.
Yeah.
Different people have different tipping points to make a change in their life. Some
Mm-hmm.
people, they get married, they want to make a change in their life, they get a new job,
Right.
they have a life-changing experience like me. Very, very few people
Mm-hmm.
make a change just because they've gotten information that they believe in, but they
Right.
can't relate to because it's just too far out. I would tell them you're not really giving up anything if you stop eating grains. There are great substitutes for grains. You
Right.
will not miss them.
Yeah, exactly.
You're not going to give up anything if you don't eat um, processed sugars. You think you may, but you really don't. For the next first 2 or 3 weeks, you'll have residual effects, but
Yeah.
it'll go away. You're not going to give up anything if you stop vegetable seed oils. So I suggest you think about changing your dietary habits for at least 30 days and
Mm-hmm.
give it an opportunity to see how you're dealing with it. The biggest problem, and I hear it from functional medicine guys all the time, is that they get their patients off and then they say, well, now we can reintroduce this or reintroduce that. The problem is our DNA has evolved for at least 160,000 years. And our DNA knows what it needs and
Mm-hmm.
it kind of knows what it cannot accept.
Right.
Our DNA knows that it cannot accept processed chemical foods.
Right.
Our DNA knows that it cannot eat grain products every day because of the excess carbohydrates and the damage to the gut microbiome. Our DNA knows that processed sugar and processed seed oil products are not natural. They're very inflammatory. You just have to avoid these things. But you'll never miss them after the first 3 weeks,
Yeah.
and you will be healthier. How can you prove it? You can't, because you're not going to get sick.
Right.
But I got to tell you, it's a smart thing to do. And if you are like me and you have this diagnosis, a severe diagnosis, a health related diagnosis, just be aware there are things you can do to improve your immune system.
Mm-hmm.
Don't only listen to the one guy with a white coat that says you have to go my way or
Right.
you're not going to survive. There
Agreed.
are other ways. Do your own research. If your healthcare professional, your MD, does not want to discuss things with you, just fire him or her and go to somebody else. There are many nutritionally oriented oncologists. They still do chemotherapy and other things, but they understand the interrelationships better.
Yeah.
And then there are many functional oncologists that lean you toward more natural ways to heal your body, but maybe still integrate certain conventional therapy. I'm not against conventional therapy.
Yeah.
I'm just against the therapy that is archaic, that destroys my immune system. Why
Right.
would I want to do that?
Yeah.
I want to repair
It's
my body.
Yeah, it's clear that the patient, and we're all patients at one point in time, that we need to be empowered and we need to have a lot of knowledge and we have to take control of our healthcare, our health destiny, our healthcare path and all that. This is why it's so great talking with you, Al. You have a great perspective. I think a lot of it came from this life to near death journey. I'm
Yes,
so
of
glad
course.
you're still with us. I'd like to wrap things up. I really enjoyed speaking with you. Thanks for talking about gum disease. one thing I'd like to say is that if you're a dentist and you want to become more functionally minded, I mean, Dr. Danenberg provides a service. I mean, it's a consultation kind of thing, teledentistry. He sees a lot of, he doesn't see, well, via Zoom, but he helps a lot of patients. But if you're a dentist and you want to know more about this, take his course. Also call him up, and it's worth the 1 hour consultation fee. You can just nerd out with Dr. Danenberg and find out more about what to do with your patients. So read his book, go to his website. I'm going to link to all of this. I love reading your website. I came across that about 3 years ago, and it was so refreshing. It's like, there's a guy out there talking just as crazily as I am, right? Crazy thing.
I'm not sure that there's anybody other than you and I.
There are a few.
You and me that
it's
out
growing.
there.
Thank goodness. You're on our functional provider list, which my daughter and I and my team at AADSM is trying to build. We have almost 100 dentists on that because we get a lot of patients. We get a lot of readers and viewers on AADSM asking, I hear what you're saying. It makes perfect sense. My dentist is not saying it, doesn't even know anything about it. Where do I go to find someone? And that's why we're building that list. And you are I think you're our only periodontist on the list.
Thank you. Yeah. That's good.
So you can see Dr. Danenberg virtually. And even if you're a dentist, I would definitely recommend giving him a call and spending an hour with him or more. Take his class. As you've seen, you see the big picture, and I'm so glad that we had this time, this opportunity to talk about it. And I think it's going to help a lot of people. And thank you. I mean, a lot of people that have had a diagnosis like you would, go to Europe and have spend those last few dollars, and here you are educating and teaching and giving back to so many people. And I really, really appreciate that. So
thank you. That's very kind of you to say.
Yeah.
But I love it too. I mean, this is something I have a passion for.
Absolutely. And I'd love to get you back on the show. We can talk about so many things, probably more gut microbiome stuff. So again, thanks, Dr. Danenberg. And I very much look forward to collaborating with you in the future. So have a great day and enjoy it. And thanks. See you later. Bye.
Thanks.